Well, today on the show, we're at the offices of Dr. Mark Shuttleworth Chiropractic Center over in Gulfport. How are you? It's good to see you. It's been a while.
Good to see you too, Jim.
Well, we wanted to come back because one of the great things about your practice is that you stay on top of things as far as different ways to treat your patients and so many different things. You know, people think that chiropractors are just go and snap, crackle, pop.
Sure.
But it's a whole lot more than that.
Yes, it is. Yes, it is. And I appreciate you being here.
Well, thank you.
I've been here 31 years.
Wow, that's awesome.
Fantastic. So I think you were here about 5 years ago. So
It's been a while.
I wanted to show
still
you.
had hair.
Yeah, well, I wanted to show you a few things that we have.
Sure.
Okay. First of all, I'm a chiropractor. I've been here about 31 years. We treat back pain, neck pain, and headaches. We also treat shoulder pains, knee pain, a lot of different issues. Headaches, a lot of headaches. We do manual chiropractic, but we also do what's called pro adjuster or instrument adjusting. So I'm going to show you a couple of things about that first.
Okay.
Now, basically, you have some vertebrae that might be shifted out of position, okay? And sometimes they get locked up. When I say locked up, picture like this. Picture these being vertebrae. They're just little blocks of wood. But see how they move? That's how your spine's supposed to move. A lot of times when I see patients, this is going on. There's some fixation, there's motion that's not happening. So what we want to do is find out which areas are not moving and work on loosening them up and moving them fine. Not where they're moving too much, like this one, not where they're locked up, but where they're moving properly.
Right.
So we're going to start off and show you a Pro Adjuster scan, which is right here. Let me show you how that works. This is Bree. We're going to use her as a patient here today. And we're going to get started. Now this is the scan. The computer shows me which ones I need to work on, and then we're going to do some treatment. So we're going to do some treatment right now.
And what is this doing, basically?
It's basically moving the spine. It's like a mini jackhammer. It doesn't hurt, but it just loosens the spine.
Wow.
And after that, we would do another scan. We would keep treating. It also does some range of motion, so I want to show you this.
Okay.
Bree, go ahead and sit up for me. We can literally increase range of motion instantaneous by doing this. All right, Bree, turn your head to the right. So we also can use it here to stretch some muscles. A lot of patients have decreased range of motion in their neck. Okay, turn back toward me.
Goodness.
Yeah. So lean your head over like this.
Keep doing that, she'll be like an owl. She looks behind her.
It works really well. All right, we also have a warm laser. Since you were here last time, we bought this laser, and it works really well. It works on increasing circulation, also decreasing pain, but it also speeds up the mitochondria of the cell, which you might have remembered from 8th grade science.
Yes, I remember the
powerhouse of the
mitochondria.
cell. So what it does, basically, it increases the speed of the cell, allows healing to happen faster.
Okay.
So we're about to go into one of the other rooms, so I can show you some other things that we do. Okay?
Now, what is this machine used for?
Basically, this is a DTS machine. It stands for decompressive traction. And so what we do is we use this for patients that have neck pain or disc problems. So we can program it for somebody who has just a chronic neck problem. We can also program it for someone who has a disc problem. We're getting really good results with this.
Excellent.
All right, we also can do this same type of machine with a different harness. We can hook a patient up to low back lumbar traction. And here you see Casey hooking up Aaron. Basically what this does, it treats chronic low back pain, acute low back pain, and also disc problems. As you see, Casey's giving her the safety switch.
So if there's too much pain, she can push the switch and...
Well, if she's uncomfortable or has any issues at all, she's in total control.
Wow.
All right, after this, I want to show you some other therapies that we'll be doing also.
Dr. Shuttleworth, you showed us how to, you've worked on the spine and the neck and things like that. What about the muscular system itself?
Sure. All right, as you see over here, I've got Bree who's doing some vibratory massage on a patient here, and I believe that's Lexi. And so what we're doing is we're relaxing the paraspinal muscles, and the paraspinal muscles attached to the spine. And so what happens is if those muscles get tight, then it'll keep the vertebra locked up out of position. So we're trying to loosen those up.
Do you see a lot of that, people that have an occupation where they're sitting at a desk at a computer all the time, kind of, maybe not even using proper posture? Do you see a lot of those issues coming in here, that dealing with that?
Yes, I do too. And also over here you can see Casey's working on a patient here. This is Erin, I believe. And so what we're doing is we're working on her shoulder and her upper back. This is called percussion massage. This this massager works really good. It's a deep percussion massage, so it'll work those deep muscles of the shoulder. We can also work the hips with that too. It works really well. Also, I'd like to show you some other therapies that we have in the other room.
Now, what is this that Casey's been is on?
Yes, this is called intersegmental traction, Jim. What this does, we talked earlier about the spine having proper motion. Well, we want to put proper motion in the spine. So what this has is a roller, goes up and down her back. As you
It's
can
one
see
of my favorite machines.
Yeah, you see
I
her
love
spine, see her abdomen raising up and down. What that is that's a roller going up and down her spine, keeping proper motion into her spine. Now, not only does it feel good, and like you said, it's one of the patient's favorite therapies, but it's very therapeutic. Really works on taking care of the motion in the spine. And over here, we have muscle stimulation. This is Cynthia. She's getting some muscle stim on her upper back. We want to make sure, in her case, upper back and neck pain, we want to make sure that we're relaxing the muscles, and the heat brings fresh blood to the area and helps relax the muscles that way. So she's getting the heat to relax the muscles.
Similar to the TENS unit?
It's a little different frequency, but kind of the same principle.
No, because I've had some treatments from me before, and then had the TENS unit on me, and that's great for the muscles as well. But again,
TENS units have a certain frequency. This has the same type of frequency, but it also has what's called interferential current, which also works very well for decreasing pain and inflammation.
Talk about therapeutic exercise.
Sure. In addition to getting the patients out of pain and getting the spine in a better alignment, we want to work on getting the spine stabilized and strengthened. So some of the things we do here is we start off, usually have the patients just ride the bike just a little bit. Okay, we're not trying to get the heart rate way up. We just want to get the blood flow going so that the blood is in the muscles and the muscles are warmed up. And if you notice over here, Casey's helping with some stretches. So we want to help the patients get their hamstrings and their spine flexible. Most patients with back pain have tight hamstrings, so we want to work on stretching the hamstrings. And over here, you can see Bree, she's doing exercising for the upper back. That's important because if you have neck issues or upper back issues, you want to strengthen that area. In this day and age with people looking at their phones all the time or looking at their iPads or looking on computers, basically what happens, the upper part of the back starts giving you problems. And so we want to make sure that's not only flexible, but we're strengthening that also.
All right. Well, Dr. Shuttleworth, it's great seeing you again. If you'd like some more information, of course, you can go online, check out their website, check out their Facebook page. If you're having some issues, any part of your body, this gentleman can get you straightened out and on your way to a good, healthy lifestyle. So visit Dr. Shuttleworth here. He's located on Pass Road in Gulfport between Courthouse and Tea Garden. The Shuttleworth Chiropractic Center on Pass Road in Gulfport.